Today we're talking about hormone replacement therapy. I'm here at Skin Bar with Kim, asking some of the big questions. Number one, we know that women make up the majority of your clients when it comes to hormone replacement therapy, but men are coming in too. Why are they coming in for this?
Well, the three biggest things that we hear from men when they come in is loss of energy, lack of libido, and a lot of ours are complaining that their workouts just aren't what they used to be.
Okay, and you're also seeing a difference in age too. I mean, you are seeing people over 40, but you told me even 20 to 30-year-olds.
Yes, we're getting the late 20s, some early 20s and early 30s coming in, and when we run their testosterone levels, they're down between the 200 and 400s.
And where should they be at that time?
When we do hormone replacement therapy, we like to see them between 9 and 1100.
Okay, so someone comes in and they get a consultation. Walk us through that process.
So you'll come in, we sit and we talk, is hormone replacement right for you? The first thing that we're gonna do is take your background, your medical history. Then we're gonna do a full lab panel on you. It's not just your testosterone level. We're gonna check, your thyroid. We're gonna check your vitamin D, make sure that's not deficient, vitamin B. We're gonna check all your sex hormones, everything that goes within hormone replacement therapy.
So let's say you can discover somebody has a thyroid problem then, and that's not their libido isn't the problem. It could be something else that you're seeing,
Yes,
right?
correct.
That hormone replacement could help with.
When we look at thyroid, most doctors here in town, they run a TSH. Some runs a T3, T4, but very few are running a TPO. And TPO will actually check and see if your thyroid has inflammation into it. It's called Hashimoto's disease.
Right.
We have caught so many people that has never been told that they have Hashimoto's. But again, if you have low thyroid, before you check that, we want to make sure that we're checking your ferritin levels, which checks for iron deficiency. And within iron deficiency, it mimics the signs and symptoms of low thyroid. So we have to know exactly why you're feeling the way you're feeling and what we're treating.
So people might think, I'm so fatigued, it's got to be this, and really it's something else.
Correct.
So the blood work is really important before
Yes.
you decide how to move forward. Okay, now with the women, perimenopausal and
Yes.
menopausal women, there were concerns about cancer. I remember hearing about this. Where do we stand now?
Well, as you can see, there's new studies out. They are finding out that it's not just cut and dry anymore, that it's, it can be some genetic traits. We ask that if anybody has a family history of breast cancer, any type of cancer, that they do the gene testing and they find out if they have that trait as well before we start treating them. Okay. But there are a lot of studies out showing that no, estrogen doesn't cause that cancer.
And you're seeing people, a lot of women coming in, I'm going to focus on the perimenopausal and menopausal, with symptoms that they're not getting relief from. So
Right.
what are you hearing? What is the problem there?
The biggest things that we hear from women is their doctor is telling them this is normal for their age. It's just part of the aging process. But when it comes to signs and symptoms, the first thing that we kind of see in perimenopause is your sleep. You're just not sleeping as well. You're waking up in the middle of the night. You're waking up at 2 or 3 in the morning. And it's because those progesterone levels are starting to decline. We get women all the time in a family practice clinic saying that they have a UTI, and then when we test them, they don't. One of the signs of lack of estrogen is recurring feeling of UTI signs and symptoms.
And I've never even heard of that.
When we look at estrogen, we're looking at joint pain, we're looking at vaginal dryness, we're looking at,
I hear night sweats.
Night sweats, absolutely. That's one of the biggest things. And then, a big misconception is that women don't need testosterone, which testosterone in women is osteopenia, osteoporosis protective, it's cardiovascular protective. It actually helps us with our brain fog, memory issues, lack of libido, energy levels, to name a few.
So there are 3 types of hormone replacement therapy.
Right.
Can you walk through?
Those are the 3 that we offer. So we do have the cream. That is just where, you can put it on, the back of your arm or your inner thigh. There's actually troches out now too, where you just put them in between your tongue and your cheek and let them absorb. And then we have the testosterone shots. And then we have the pellets, which come in testosterone and estrogen.
Is there a difference in effectiveness, or how quickly they work, or how long they work?
That depends on the studies you're looking at. Of course, I've been certified in all of them, and the research and the studies that I show shows that the bioidentical pellets are the best route, and we have to find what directly works for you.
How soon does someone start, if it's working, when do they see, everybody's symptoms are different,
Right.
but when do they start seeing some relief in your experience?
So once we start them, it depends on if we start them on the shots, if we start them on the pellets, or we start them on the cream. But basically, it's within 7 to 14 days they start getting some relief.
Okay, so give me the feedback you're hearing from women that this has made a difference.
You know, the biggest thing that we hear from women is the brain fog is lifted. They no longer feel foggy. They feel like their husbands love them again because they have that libido back, and then the energy levels.
Yeah, and what about the men?
Same thing with them. The biggest things that I hear from men is they don't talk as much about libido as they do their energy. They're getting out of bed quicker. They're mowing the lawn without having, to be threatened by their wives, or they're pulling shrubs out when they were only supposed to be mowing the lawn because they have the energy to do so.
Okay, and that is within a couple weeks?
Mm-hmm. Yes, ma'am.
Is there anything, like if someone's out there listening to this now, and they're wondering if it's right for them, you have some words of advice?
Yeah, come in, speak to one of our professionals. Most of the time you'll meet with me for consultation. We'll go over your medical history. We'll go over your signs and symptoms, start with a blood draw, and then we can get you started as early as 10 to 14 days.
Thank you, Kim.
Yes, thank you.